Welcome. I'm Andrea Clessy for Women's Hospital. At different stages in our lives, women are strongly encouraged to undergo specific health screenings. Colonoscopies are one of those procedures. While they're not the most pleasant experiences, Dr. Kelly Finan explains what to expect and offers some good advice.
Most of our patients that come to us for screening endoscopy are at age 50, and that's when we generally recommend screening start. We do screening to try to find polyps, because polyps can turn into cancers. Not all polyps grow into cancers, but we know if we catch a polyp early and remove it before it turns into a cancer, we can actually prevent colon cancer. That being said, even if we find a cancer, we'd hope to find one early when it's in a more curable and treatable stage. Colon cancer still remains a large killer in the United States today. Approximately 150,000 Americans are diagnosed with colon cancer each year, and it is attributable to 50,000 deaths in the United States each year. For women in particular, colon cancer can affect 1 in 19 women throughout their lifetime. These are all huge statistics when we think about it, because 90% of colon cancers are actually preventable with proper screening and early polyp detection. Louisiana in particular ranks 43rd in the United States for proper screening. So we have a lot of room for improvement in our state alone. Again, we can prevent colon cancers by detecting polyps early and removing them before they turn into cancers. Or at worst, we hope a colonoscopy can detect an early cancer that's much more curable in the treatment phase than a cancer that's spread to other parts of the body. Colonoscopy can also be used to detect other diseases such as inflammatory bowel disease, Crohn's disease or ulcerative colitis, or things such as diverticulosis, vascular abnormalities causing bleeding, ulcers, and a variety of other pathologies. If you have a completely normal colonoscopy, you don't need another one until 10 years. If we find polyps or other abnormalities, we may change the recommendations at the time interval to repeat it. Now, there's a catch to that. If a family member's had a polyp or a cancer, you want to start screening 10 years prior. So if mom or dad had polyps at age 50, you actually want to start your screening at age 40, because we know there may be a hereditary predisposition to forming them earlier. There's certain disease conditions, again, such as Crohn's disease or ulcerative colitis, or genetic predispositions that would encourage us to start screening earlier. But again, the general age for all people is 50. I think the biggest fear people have in getting a colonoscopy is undergoing a bowel preparation. Most patients actually will tell me afterwards it wasn't as bad as I thought it was, and I wish I hadn't avoided it for years. The bowel preparation, though, is a necessary evil. We need the colon clean so we can see the lining of the bowel wall to look for any abnormalities. The prep consists of starting the day before. Usually you take a few pills to start getting your bowels going, and then you have to drink a liquid preparation. About every 10-15 minutes you drink a cup of this, and it will purge your colon. You usually go to the bathroom for 3-4 hours. It's not the most pleasant experience, but it's not the end of the world. And again, most patients tell me it's not as bad as they thought it was. The colonoscopy itself usually lasts about 30 minutes. There's very few risks involved with the colonoscopy, is what makes it such a safe screening tool. There's less than a 1% risk of bleeding, and that's more so if a biopsy is obtained during the procedure. Further, there's a less than 1% risk of damage to the colon wall, such as perforating the bowel, because we are putting a foreign body in the colon. The morning of your procedure, you'd come to the hospital where you're escorted to a room, and you'll meet with the nursing staff, anesthesia staff, and have an IV placed. You're then taken back to the procedure room where you're given some IV sedation that makes you sleepy, where you don't really recall what's going on with the procedure, and it makes you more comfortable during it. Then I would start the procedure by inserting a scope into the rectum, and the scope is advanced the whole way through to the colon. We know we've made it to the end of the colon when we see the appendix and the small bowel opening. Then we slowly withdraw the scope and we look around the colon wall and try to identify any abnormalities. If we see a polyp, we remove it at that time, or if a mass is too big to remove, we'll take a biopsy and send all those specimens to pathology. Then you're awoken from the anesthesia and taken back to your room to recover, and usually patients are home about an hour later. I don't think anyone should be on the fence about getting their screening colonoscopy. If you avoid your colonoscopy, cancer's not necessarily going to avoid you. 1 in 19 women in the United States will actually develop colorectal cancer each year, but we know with proper screening, if we can remove polyps before they turn into cancers, we can actually prevent 90% colorectal cancer. So again, you'd much rather have your colonoscopy, I think, than develop a cancer and need a major surgery in the future. Well, maintaining a healthy colon kind of goes in line with maintaining a healthy lifestyle. We can encourage patients to eat a diet lower in saturated fats, red and processed meats, and alcohol, and to eat a diet high in fruits, vegetables, fibers, calcium, and folate. Maintaining a healthy body weight and exercising is also important for colon health and avoiding smoking.
For more information, visit womans.org. Womans, exceptional care centered on you.